Here we go.
Hello.
Hello,
How are you?
Yanni. Good to see you, my friend.
Nice to see you, George. How are things in DC?
Very good. And how about things in London?
All good, all good. We're starting to feel a little bit the spring here. It's starting to get a little warmer.
It's starting here too. How's the family?
We're all well. Everybody's good, busy with school and work. And yours?
Very good too. We had a fun sports weekend, and now we're ready to get back to school, get back to work, and let our followers get them a little educated and have some fun along the way, right?
Absolutely. I think it's a great opportunity, first of all, to reconnect and to exchange ideas. I know you are very active in facial rejuvenation in DC, both on surgical and non-surgical. And we are as well in Harley Street. We perform a lot of these procedures. And recently has been a lot of interest in facelifts. They have become, allow me the term, a little fashionable. Do you agree, George, about that?
Oh, yes. And I think there is a lot of good information out there, but there's a lot of misinformation as well. And I think that's why you and I decided to sort of like dispel the myths and set the record straight.
I think there's a good reason for that. We went into non-surgical very deep in the early 2000s. Botox fillers became very popular. And a lot of people thought that they would replace facelifts in a magic way. But now what we see is actually almost a backlash, especially with fillers being overused and not really achieving the results that people thought they would. So there is a return to facelifts. However, I feel that now it's a mature environment. It's an environment where doctors and patients are looking for more natural results, results that fit their expectations, and the techniques have improved a lot.
Well, speaking of techniques, Yanni, I think it's important for us to tell people a little bit about our background and for them to realize that it takes a lot of training to become a good facelift surgeon. Dr. Alexandridis and I met in residency, so we go back 32 years. Remember, you gave me the tour of our general surgery residency program back in the day.
It's true. We go back 30 years. We started together with general surgery, and then we continued in plastic surgery. I know you also did specialty treatment in aesthetic surgery, George, and likewise I specialized in microsurgery and craniofacial surgery. So we got a lot of training under our belt.
Yeah. And what people don't realize is to become a plastic surgeon, first you do general surgery, you do liver transplants, you do open heart surgeries, you learn about trauma, you learn about reconstruction, you learn about the tissues, you learn about the face from the bone all the way up to the skin, and do endless cadaver dissections, endless courses to be able to get us where we are right now. So I think that's important for our followers to know that you don't just become a facelift surgeon overnight or just taking a course. It takes years and years of doing hundreds and thousands of these. You know, between you and I, we've probably done thousands of facelifts. So I think let's get to it. Yanni, what are your thoughts about the different kinds of facelifts?
So I have been through a lot of different phases in my career, and I like to customize my facelift according to the patient, and all depends on the anatomy. It depends on the age they are, the skin quality, and also what are the expectations. And a lot of people want different things, and sometimes instinctively you would think that a person would want, for example, a full facelift with a brow lift and blepharoplasty, but occasionally you get these people who just want one thing fixed. So I customize my facelift to make a plan after a very serious and in-depth consultation. During that consultation, I'll let the patients talk. I want them to explain to me exactly what they want. I want them to show me pictures of themselves from a younger age to understand the aging process that they have been to, and also to see if there's any special requirements. I mean, recently we have seen a lot of patients who have lost a lot of weight. They take medications that help them lose weight, and we all know about the Ozempic phase, for example, where you have a very specific type of aging with a lot of volume loss. So at the end of the consultation, I make a plan, I discuss it with them, and then when the surgery comes, I follow the plan, and I don't deviate from that, because sometimes during the surgery, you may consider doing additional things or change the plan, but I like to stick to the plan that I've made with my patient before surgery.
True. I take a similar approach. As you know, we sort of have the same philosophy in rejuvenation. I like to sit down with my patients. The first question I ask them is, do you want a non-surgical or a surgical rejuvenation? And, you know, sometimes it's either non-surgical, surgical, or a combination of the two. They may like a facelift, but they may want fillers to their lips, or they may want fillers to their cheeks, but a neck lift. So I think you and I are versatile enough that we're able to offer patients anywhere from the forehead to the neck and anywhere in between what they want. I like to start out with the basics in terms of the face, and then talk about the upper and lower eyelids, whether they need to be done. Maybe add to them micro fat grafting. I know you and I are big fans of fat grafting. It goes back to our residency days in Pittsburgh and at UVA, where we learned about fat grafting when it was first becoming popularized. So we have a lot of experience with fat grafting and stem cells to fill in the void, and then talk about laser resurfacing afterwards. So what do you advise your patients when they say, Dr. Alexandridis, I don't know where to start? How do you approach that?
So when I have this blank canvas and I have the opportunity to really give my full advice, I like to break it down in thirds. So I start with the forehead, upper third, mid face, lower face, and neck. And I analyze each area, like you said, inclusive of the eyes and also the upper lip. And then at the end, I talk about ancillary procedures you can do. As you said, fat grafting. I use micrografting. So I take patient's own fat, centrifuge it, separate everything I don't need, and I only inject pure fat cells, which are full of stem cells, as we know. We need volume as we age. We age by losing elasticity and dropping, and by losing volume on our face. So we shrink. So micrografting, 75% of the cases I will use it. It will be an important addition. And then I talk aesthetics. I compare the pictures of the younger age to the present state, and I explain how I can get to that point. And I analyze it step by step, inclusive the forehead, the brow lift, if necessary, mid-face lift, lower face, and neck. I have to say, a lot of my patients come to me and they say, I know I have AIDS, doctor, but what bothers me is this. And they point in the lower part of the face and the neck. And for that, I have developed my Y facelift technique, where it's a quicker operation with limited incisions around the ears only, where I take advantage of mass elevation in the lower part, tightening the jawline, lifting the platysma muscle on the neck and tightening the neck, and then accentuating the jawline across here. And that works very well for patients who want a quick recovery, and they want the results to be focused on that lower part of the face and neck.
You know, you bring up a good point. I think when patients come to us wanting a facelift, I think it's important for us to understand, A, where they are in their age. You know, we're not going to do the same facelift on a 40-year-old who lost weight from Ozempic versus a 77-year-old who was in the sun all her life and has a lot of swinging in her neck. You know, they require different techniques, they require different levels of aggressiveness, and they require different areas of the face to fix. You know, since you mentioned the Y lift, I'm going to show some of your beautiful results on Y lifts, and let's talk about them a little bit. This is your Y lift. I see a very nice result here where you have tightened her neck. The jawline looks good. She has a nice high cheekbone. You don't see the scars. Excellent job, my friend.
Thank you. I think think the added advantage of this, George, is that this lady is able to go back to most of her activities after a week. And we know that we can go into deep plane facelifts and do extensive work on forehead, eyelids, and then you have a beautiful result, but then you have also a longer recovery. And I think for a lot of people, there is a fine balance between the two. So it's able to be flexible on what you recommend and not rigid in your recommendations, where in some other colleagues of ours, where you just have one operation that you offer to everybody, and it doesn't fit for everybody. Well, and I know you have your model lift, where you do a combination of sometimes non-surgical things, right?
Yeah. So I want to show a couple of model lift patients and go over them. You know, a model lift basically to somebody who's younger or somebody who is older. It can be all non-surgical with neurotoxins, fillers. And you see this beautiful girl here did not like her nose, did not like her cheeks and her jawline. And you can see how a model lift gave her a beautiful balance between her nose, cheeks, and jawline. I mean, the reason why I coined the model lift is because all models have one thing in common. They have a nice balance between their cheeks, their nose, and their chin. And your practice in London and my practice here, we see a lot of different ethnic backgrounds, and we have to be flexible in giving them a beautiful result, taking their ethnicities into consideration. You see how the cheeks, the nose, the lips, and the jawline balance nicely.
A very natural result indeed. And I'm glad you're touching on this topic of younger patients. I see a lot of younger people who now don't want to wait. There is this trend of treating problems of aging as they start, instead of waiting for years for things to become worse and to wait for a big operation in an older age. We see more and more patients that want to have the youthful look maintained through the years rather than wait for many decades before doing an operation. Do you see the same?
Yes, and let me show you another model lift on a lady that I did that basically is a model herself, and I did her rhinoplasty. She was happy with her rhinoplasty, but she did not feel that the rhinoplasty gave her the complete look that she wanted. So I did a model lift on her by filling her cheeks, her lips, and her jawline, and see, it's a very nice natural result. And this lady's movie career really took off after that. So sometimes it's about giving people self-confidence. Sometimes it's about fixing the one or two things in their face that they're not happy with. And I think you and I are in a very privileged position that we are able to offer people a nice spectrum between fillers and surgery. And I'll let people know that I went and visited you in London in the year 2000 when fillers were just starting. They weren't even FDA approved in the United States. So you were a pioneer in London and I was a pioneer here. And for us to have seen fillers that have evolved over the last 20 years, and they took their right place. You know, they're not for everyone, they're not for everything, but they certainly fill a need for people who want to look better but do not want to have surgery.
I couldn't agree more with you, George. I think it's all about putting the patient in the center of the stage here. It's all about the patient. We're here to help, we're here to give advice, but at the end of the day, it's the patient who wants something for themselves to feel more confident, to improve the quality of life. And sometimes what we think is not 100% aligned with what the patient wants. And we need to have this receptive state of really getting to the bottom of that. Recently, just to be a little bit on the gossipy side, we've all heard about some very famous male actor having a facelift. And I do see a lot of men now requesting facial
I'm putting
rejuvenation.
one of your deep plane facelifts up here, Yanni.
Yeah. So yeah, this is a deep plane. And why did I choose to do a deep plane on this gentleman? Well, he had a facelift before, so we know that if you have a facelift already, there's not going to be a lot of skin to remove. It's all about reforming and restructuring the deep planes of the face. So that's where the deep plane works better. It's about creating a result that is also natural. So no tension on the skin. There's nothing that looks pulled. Everything is done from the inside. And also the results last for a very long time. So indeed, this gentleman, but by the way, he completely saves his head. So the scars are really fading away very nicely. They're not a problem at all. It's all about knowing where to place the scars and how to do your stitching really in order to give scars that are imperceptible.
I gotta compliment you because that's a beautiful result, and maybe on Instagram it doesn't show too well, but you kept his scars inside the ear line. You gave him a very nice contour to the neck, and you can see here the nasolabial fold and the labiomandibular fold have been nicely softened without them looking artificial. I think that's a very nice indication for a deep plane facelift, as you mentioned. When you don't have too much place to play with the skin that's already been tightened from a previous facelift, you kind of your options are limited. I like a deep plane facelift in this situation to lift up the SMAS that is close to the smile line without having to put the skin under tension. I like to combine, I have my hybrid deep plane facelift, which is basically tightening the SMAS as well as doing a suture suspension neck lift. You see this lady here, I did a tightening of the SMAS in this area here in the deep plane, but I also did my suture suspension neck lift, which basically I tighten the muscles in the neck, and it's a permanent suture and a permanent result. I also added some fat grafting, which we both probably agree she needed because she had a deflated face. And I did her upper and lower eyelid lift. And you can see she has a very nice natural result.
It's a great result, and it gives me the opportunity to talk about the neck, because in the majority of the facelifts I always advise patients to do at least some work on the neck, because if you leave the one without the other, it doesn't look natural and the results are kind of halfway house. So I think the neck is an important area. It requires special techniques and special treatment in order to get the best possible results. The neck can be very complex and very difficult to treat in some patients, and this is an excellent result. The suspension technique helps a lot. I also like to use the platysma raphe technique, which we can use either from the side or from the center, or in certain cases in combination. Sometimes a small submental liposuction works well as well in this area. And in some cases, you need to also give a little projection to the chin. Some people have a very weak chin where you need to really maybe add a chin implant or some kind of projection in order to get the best possible result. So it's all about aesthetics. It's all about showing to the patients also how will they look with the different procedures.
You know, Yanni, I put one of your wide facelifts up here. I have to tell you, that's a beautiful result. This is a difficult neck. You were able to lift up those lower skin lines here to give her a very nice, smooth contour to her neck. Tell us about this one a little bit.
So yes, this is a heavy type of skin. So I know that in this, I need to really work in the deep layers. I really need to work on the SMAS and the platysma very well, and I need to put multiple stitches in order to maintain the effect. But the benefit on this, on the heavy necks, is that once you do the deep work well, the skin comes and complements the results so nicely, because the skin is thicker and it gives this natural look. So I agree. I think this is a patient who actually is very happy with the results. And despite the fact she didn't want a full facelift, we were able to give her the expectations that she had, which was about streamlining the jawline, improving the neck, and taking away the jowls.
I want to talk about this lady because I think there's a couple of lessons to be learned here. This is a lady that I did a rhinoplasty on and a facelift with some fat grafting, and I want to highlight a couple of things. We talked about the suture suspension neck lift. Look at how beautiful it gave her a nice natural looking jaw contour from my suture suspension neck lift. She also had a paucity of fat here in her lower cheek. I end up doing some fat grafting to the lips. I did her lower eyelids, so that heaviness here, I took the fat from the lower eyelids and combined them with the cheek fat to give her a nice smooth transition between the lower eyelid and the cheek. And with the combination of the suture suspension neck lift, a hybrid D-plane facelift to soften that line that she had here, and a rhinoplasty, it just gave her a very nice contour to her neck, her cheeks, and her nose. What are your thoughts?
I think that one of the most difficult areas to fix is this transition between the lower eyelid and the cheek, and this is an excellent result where you have reformed this as it should be. So it has been shortened, so the distance is not so long anymore, and it looks natural. It looks like actually that she never had any operations. However, the result is so natural and so pleasing. So for me, eyelid is the next operation that can complement a facelift, because it is the area with the thinnest skin, the skin that is very mobile due to the expressions of smiling. And a lot of my patients show the first aging signs around the eyes. So either as
Yanni, this is one of your upper eyelid lifts. Tell us about her, because that's a beautiful result here.
So yeah, this lady complained about her eyelids being hooded, that she had lost this first fresh look, and she said that people were looking at her and they thought that she was always tired, and she was tired of listening to that, and said, I want
being told she was tired, right?
Exactly. So periorbital surgery is so important. It's very powerful, but it's also it needs to be very meticulous, because the skin there is very thin and prone to complications if you're not careful. I think there is about judging how much skin and fat to remove without overdoing it, and giving this person this open eye look that looks fresh and not operated. I don't like to change the shape of the eyes when I do eyelid operations unless there is a reason for that. And there are some exceptions to every rule. But in this lady, I just, I was very happy with the almond shape that she had. I just unveiled her natural shape.
That's a beautiful result. I wanna bring up a point about eyelid lifts, because I think that we get asked from patients, if I do my facelift, am I going to get eyes that don't look like my eyes? A lot of patients, I'm sure they ask you like they ask me, if I do my eyelid lifts, am I going to look like a deer caught in the headlight? And for us as plastic surgeons, we know that they're not going to look like a deer caught in the headlight, but for some patients, they worry and they confuse an upper eyelid lift with a brow lift. Sometimes, I know you and I have discussed this in the past, we do a brow pexy where we lift up the upper eyelid from the inside. And actually, I learned that technique from you, so I give you full credit for that. But when I do my upper eyelid lifts, I go back in and I suture the skin of the eyebrow to the periosteum or the bone to lift it up a little bit. I did it on this lady with a facelift, and I just want to point out that she does not look like a deer caught in the headlight. I'll just, for the sake of complete disclosure, I did on her an upper eyelid lift, a lower eyelid lift, and again, I combined the fat of the lower eyelid with the cheek. I did a facelift with a deep plane hybrid facelift. So I did the deep plane for the nasolabial fold and a suture suspension technique for the neck, because she had a very stringy neck. That was a difficult neck. And the neck has been nicer and smooth. And then I did a full face erbium laser that heals quicker than a CO2 laser. But I want to show you the results of the eyebrow, the eyes, how they are nice, and the transition between the eye and the cheek is a nice, smooth transition. And the laser has given her a nice, smooth skin. What are your thoughts about that?
Indeed, I think a lot of people, as you said, like your patient, are afraid that after an eyelid job, they're going to look unnatural. And that has to do with some of the older techniques plastic surgeons used to use, and they remove too much skin and too much fat, and they would leave a skeletonized orbit around the eyes that looked actually quite aged. So we have moved away from these techniques, and with this example that you just showed, you maintained the natural elements of the face of this patient and you kept the volume. And with using a deep plane technique, you managed to lift up the ligament of the mid-face closer to the eyelid. So you got support from your facelift. So you help the eyelid result through the facelift. So a lot of times, like you, I like to combine a deep plane facelift with the lower eyelid in order to get the best results. And also in the upper eyelid, a brow pexy, as you did, or a brow lift would be the right things to do in order to get the best result. Actually, in some cases, I only go for a brow lift because in this gentleman, he did not want to change his kind of natural, slightly hooded upper eyelids, but he was really bold because it was getting heavier and heavier. And the other problem he had was that he had a receding hairline. So with this operation, which is a hairline,
two birds with one stone, right?
Sorry?
It kills two birds with one stone.
That's right. I did two things for him with one operation, which is the hairline brow lift. So we lifted the brows in the right position for him to feel and to look better, but also we brought forward the hairline without having a hair transplantation, basically. And this is an operation that usually takes me an hour to do. Today case, so it's a quick recovery as well.
Let me ask you this, Yanni, because I think that you can do 3 operations in one in this. Because when I do the hairline brow lift, I also cut the muscles on the undersurface to weaken the frontalis muscle, so you don't have to get Botox again. So basically, yes, it reduces it brings down the hairline, it lifts up the eyebrow, and it softens the wrinkles. And I do see these wrinkles are softened. Tell us about that.
So yes, of course, in this operation, it's very easy to be working on what we call the frontalis muscle. This is the muscle that creates the horizontal wrinkles, but also work on the corrugator, which is the one that gives us these 11s over the nose. And I don't like to remove completely the muscle, but I like to weaken it because that gives a more natural result and it doesn't let the brows separate in the middle. So I get natural results, and these patients don't need Botox after this operation for many, many years.
Okay, I want to show a couple of fat grafting pictures because we both do a lot of fat grafting, and I think it's something that's a hot topic right now. I want to show one of your fat grafting patients here, and I can see how she had paucity of fat in her mid-face, and now she has a nice rejuvenated mid-face that looks less tired and more refreshed. Tell us about her.
So when I consider micrografting, I treat the whole face as one aesthetic unit. I really create a map of the areas I'm going to inject with how much volume I'm going to inject in each area. And this result shows you how powerful this procedure is. This is a lady that in many other places she could have been treated with a facelift instead of micrografting, but she had no facelift. She only had micrografting.
Result.
I injected approximately 55 cc's in the whole face, and restoring the volume on the mid-face took away the nasolabial folds, recreated the jawline, and adding volume in the temple also gives a brow lift effect. And it normalizes the shape of the face, which we see that before the operation is kind of broken and it looks jowly, whereas in the after operation it looks smooth and it has an oval shape similar to a more youthful effect. And I have to say,
let me interject. Another thing about your fat grafting to this lady is by giving her nicer cheeks, it made the nose look smaller. Because now there's balance between the cheeks, the nose, and the chin, whereas before the nose dominated her face. So kudos to you.
Yes, because it's all by comparison, right? So as the face gets longer and slimmer, the nose protrudes and becomes bigger. A lot of people who come to me for rhinoplasty, they tell me, oh, you know, my nose keeps growing as I get older. And I think it is true that we know the nose can grow by a few millimeters, but what you get from the rest of your face is when the face shrinks and looks smaller, the nose by comparison looks bigger. And this is a good point, George, that you made. But I wanted to say one more thing about micrografting, which is not that it only volumizes the face, but it also supports the skin because it's full of stem cells, and we know how beneficial they are for the well-being of the cells of the skin, how they will make the skin look better, how they will make the scars heal faster and disappear. And I like to have this double effect on my patients when I do this procedure.
I want to show another picture now of a lady that I did a facelift on her and fat grafting. And I want to bring up the point, you know, to reiterate the point that you made. When somebody like that comes to me and says, should I have fat grafting or should I have fillers? And my answer to them is fat grafting has 3 advantages over fillers. Number 1, it is your own fat, so it can be permanent. I usually tell them about 50% of it will last permanently. Number 2, it looks and feels more natural and gets its own blood supply. And number 3, it nourishes the skin above it because of all the nutrients, the growth factors, and everything that's in it. So this lady, I did a facelift on her. I'll show you the side profile, but I also did some fat in her cheeks and her smile lines. And I did a corner lip lift to lift up the lips a little bit because they were kind of sunken down. And you can see on the side profile how the fat has filled up nicely her mid-cheek and her jowls, and the facelift improved her neck contour. The scar is inside the ear, so you cannot see it. And she was overall very happy with that result. That was also a hybrid deep plane facelift where you see the lines here have been pulled, and so there is that nasolabial and labiomandibular fold, or the marionette lines, have been all but erased. What are your thoughts?
I think when you use the 2 techniques together, then you get the best results because the one helps the other. And actually using fat to volumize means that you don't really need to overdo it with pulling, and you don't get into the situation that you might overpull and make someone look unnatural or feel tight after the operation. So here you have maintained the balance of these aesthetic units by volumizing where you need to, which is basically mostly the center part of the face, the mid-face, the tear-through, nasolabial folds. And did you do a little bit in the chin, George?
No, I think that is honestly her, you know, the way she was, the photography. It's not perfect photography, so there was a little bit of an angle, but I didn't do anything to her chin. If you look at her before, she had a strong chin before. She still has a strong chin, but the difference is the nose here dominated the face. Here, the nose, the cheeks, and the chin balanced nicely.
Absolutely. Yeah, it's a very, very good result, very natural. And for the people who don't have strong chin, you can use the fat to augment and to give them projection in a natural way without using a chin implant. So that's another benefit with micrografting.
I gotta say, I agree with you. I like that. But since you brought up a chin implant, that's the lady that I did a chin implant on with the facelift and the neck lift. So you can see she needed some volumizing here, and a chin implant was a more permanent solution and a more prominent solution, pardon the pun, over fat grafting. But since you brought it up, I'll show it. Let me show a couple of other before and after photos that we can discuss. So this is a lady that I did a deep plane hybrid facelift with a deep plane for her nasolabial folds and a suture suspension for her neck. And I did a full face laser, and you can see the scars are nicely hidden inside the ears. And this is her side profile. You don't see the scars. You see a nice neck profile. The nasolabial folds have been effaced. So I was very happy with her results. But then we ended up doing a full face laser on her to give her smoothness. I know when I visited you back in 2000, we were at the time doing a CO2 laser in the operating room. My techniques have changed since then. Now I wait about 3 months and I do a erbium laser about 3 months later. And my reasoning is 3 months later, I can be more aggressive and they're still a little numb so they don't feel the pain. And I tell them, you know, with this laser and the facelift, within a year, you're done. You know, your facelift is good, your laser is done. This lady is 76 years old and she looks very nice and very put together. What are your thoughts about the surgical technique of the facelift and about when do you combine lasers with facelifts? In the operating room, later, why and why not?
We should say here that the skin is the canvas we work with, and for people who don't have good quality skin, the results can be compromised, and you have to really work on the quality of the skin. So everything you can do to improve it is amazing. So we, like you, we don't use these ablative, aggressive lasers anymore that leave the skin depigmented and unnatural looking and take months to heal completely. We use pixel laser, and sometimes we combine this treatment with exosomes to improve the quality of the skin and reverse sun damage. We always advocate the use of our healing serum right after the surgery. This is actually something we give to the patients on the day of their removal of the stitches, because we have seen the improvement on the quality of the skin. And then once they have finished with the initial healing period of 6 weeks, we continue with the NaCY2 healing serum from our skin. So it is an ongoing process, and I think treating both will give you the best results, because if you have created a very nice contour with your facelift and your neck lift, but your quality of the skin is, you know, hyperpigmented and sun damage, then you're missing out, and you need to consider laser treatment. You need to consider things like micro needling and RF in order to improve the quality of the skin. So we implement these procedures. We have a method where we have a protocol that after the surgery, the patients will follow. And of course, they can opt out if they don't want to, but my nurses always guide them through this process, which can be a little complicated because according to the skin type and the problems they have, it's different stages.
Good. So I think you bring up a good point. That's a nice segue to our model skin and 111 skin. I think that I agree with you 100%. When I tell my patients, when we do a facelift on you, it's like buying a new car. You need to maintain it. You need to keep it nice and shiny. You need to keep it, you know, healthy. I have combined PRP with facelifts and lasers in the past, and I found that PRP works very well. It basically is platelet-rich plasma. I just wrote a chapter in a book about it for hair rejuvenation. So we do a lot of PRP for hair growth, and people have thinning hair. And I think PRP for just raw skin, when you do a laser, I think it augments it. I think it has a little bit of the same value as exosomes or other growth factors. Next, I think we talk about the initial phase where they heal from the laser or the facelift, and then you got to do something to maintain their glow of the skin. It makes no sense to spend, you know, a pretty penny on having a facelift and then having a skin that's not shiny and glowing and beautiful and healthy looking. Our model skin that is in front of me here on the table was designed for people who want to have a very natural skin care technique with no additives, no preservatives, no parabens. And we talk about moisturizing, hydration, and sun protection after a facelift. We have our med spa, as you know, and our estheticians who guide our patients through a very nice and rigorous skincare protocol, as you just mentioned, because sometimes the patients need to have their hands held after that process to get the best result. Tell us about 111 Skin. It's been amazingly successful, and the power to you. You know, congratulations on you and Eva creating a beautiful skincare company that is conquering the world. So tell us about it a little bit.
Well, thank you, George. I think you and I will agree that during our surgical training, we never were taught anything about skincare, and we both
Zero. They gave us
realized,
zero lectures about skincare.
yeah, but we both realized the moment we had a private practice how important it was, A, to help your patients get the best results, and B, how to help yourself really multiply the results you get with surgery with healthy skin. And I think it couldn't be any other doctor that is more relevant than plastic surgeons to talk about skin. We know how the skin works, how it heals in a three-dimensional way because we cut the skin, we work in the deep layers. We know the importance, for example, of the subcutaneous fat on the skin that no one else understands from the specialties we work with. So we were able to take this knowledge and actually create a product that will help people heal after surgery. And this was the beginning of One Skin. It was really this demand from patients and doctors to have a product that will actually improve the results and accelerate healing. And from that point, it took the help and the feedback of my patients to understand that once you have a product that does that, you can have a product that can work through the years, keeping your skin healthy. One Skin is based on NaCY2, is a complex ingredient that contains vitamin C, a lot of antioxidants, and NaC in a very protected method called neosomes. So it goes deeper into the skin and lasts for 8 hours. So the results you see are about increasing the content of collagen, elastin, and improving hydration of the skin.
One second, Yanni. I think some people don't get the relationship between hydration and improving collagen and keeping the skin healthy. I think it's important to note that when people have healthier collagen, they have reduction in wrinkles, they have stronger and more elastic skin. To us, because we've studied the skin, that seems to be pretty self-explanatory. But for some of my patients, I have to make the bridge between why we want you to have these moisturizers and these skin restructuring skincare products to restructure your proteins, to add peptides, to improve on the collagen and the elastin, so that as you heal from the facelift, you get a very nice, shiny, glowing skin. Because as you and I know, when I used to do facelifts before implementing a skincare regimen, the deeper layers were nicely tucked, but the cover was not reflecting the beauty of the inside.
It's true. I think it's easy if you explain to patients that we are made, about 70% of us is water. So if we don't have enough water in the biggest organ of our body, which is the skin, then it gets affected. And it's not just about how it looks, it just doesn't work properly. So being hydrated doesn't necessarily mean superficially being hydrated. It means that it has enough moisture in order for all the cell functions to work without a problem. And that's when you get maintained youthful appearance. So very important to explain this to patients and to actually put them on a regimen, take this opportunity of having surgery, spending so much money, but then not doing something for your skin. It's the same. It's like, as you said, buying an expensive car and then neglecting it and not taking care of it. So it's a long-term thing and some that people need to invest in long-term.
Yanni, I want to pivot back to my model lift, because I created the model lift for people who either had a facelift in the past and don't want to have any more surgery, but they want to look better, or people who either cannot have a facelift because of medical reasons, somebody who's on blood thinners, or their heart cannot tolerate surgery, or they have a pacemaker. There is an alternative that we offer at the Bitar Institute here in Washington, which is the model lift. So basically taking the dimensions of the face and improving them without surgery. This is a perfect example of a woman who wanted to look better and didn't want to have surgery. And that also applies to people who've had surgery 5, 10, 15 years ago and don't want to go through another facelift, but they just want to look better. Because if you've had a previous facelift, the skin and the muscle may be tightened, but the aging process doesn't stop. It continues. So you may lose some of the fat. You may have a little bit less, more laxity. So this is an example of a woman who did not want to have a facelift. I did some fillers under her eyes, in the smile lines, in the lips, and in the jawline. And you can see it's probably not the result of a facelift, but the nose here dominates the face. But because I filled the cheeks, now the nose and the cheeks are balanced, and so is her jawline. You can see how even without a surgical technique, it gave her a little bit more volume. So I think for people who are watching this and are feeling overwhelmed that they have to have a big procedure to look better, this is a nice alternative, not only for somebody in their 60s and 70s, but somebody in their 30s and 40s who wants to look better. What are your thoughts?
I agree 100%. And you do get patients that are not really ready for surgery, or they have medical reasons or contraindications that you cannot perform surgery. So in this case, you really need to come up with alternative ideas. And this is an excellent result. This is natural. This is something that is not just about injecting, is about understanding the 3D anatomy of the face and restoring it as it ages. And this is something that only, a plastic surgeon with the experience that has seen many hundreds of faces can do properly. It needs to be done in different, not just areas of the face, but different levels of the face. You have to inject deep in some areas, you have to inject superficially in some others, you have to avoid some areas, and so on. So that's an excellent result, and without surgery.
Well, and I want to show one more model lift on somebody who is younger. This lady who is in her 20s, beautiful lady, but she did not like her under eyes, her smile lines, and her cheek. And by doing some fillers in her cheek, it gave her a very nice overall look. And you can, if you look at the frontal view, you will see how here her nose looked a little bit out of proportion for her face, but here by doing a little filler for her nose, and you and I do a lot of non-surgical rhinoplasties, by doing a little bit filler to their nose and the cheeks, it kind of balanced everything out very nicely.
Okay. No, it's a very, very natural result. I see a question here, George. What is the best age to do a facelift? And I should say that there is a wide gap. I think most facelifts happen between 35 to 65 years old. But as we said earlier in our conversation, the age has been now pushed towards younger ages. I see most of my patients now in the early 40s to 50s. When are you ready for a facelift? Where you need to have certain signs of aging to be good candidates for facelift. For example, deep nasolabial folds, marionette lines or jowling, loss of elasticity either of the face or on the neck. These are the signs, the first signs that you will notice that will mean that you might be a good candidate for a facelift. So depending on your expectations and the not only biological age, but your age according to your genes and your lifestyle, you might need a facelift slightly younger these days in order to get the best out of it and to have the results to last for a very long time.
I think one important point I tell my patients when they come asking for a facelift, I say, what really bothers you the most? Is it the eyes? Is it the face? Is it the neck? And I think, as you mentioned at the beginning of this conversation, when you do a deep dive and you sit down with the patient one-on-one and you do a real old-fashioned consultation as opposed to, nowadays things are being rushed and people get seen by consultants, not by the real plastic surgeon. We get to the bottom of it. I mean, this is very important. This is people are entrusting us with their most precious, commodity, their face. So I think when you sit down and talk to them and you know what they want, sometimes, as we mentioned, we do the eyes only. Maybe they're bothered because their eyes make them look old, but they cannot verbalize that. They say, "Oh, I look old," but it's not the face; it's the eyes. Because sometimes the eyes are the first thing, that ages. Sometimes we need to do the eyes and the face. Sometimes the patients want to do them separately, as you mentioned earlier. Sometimes we have to accommodate the patient with the operation, not everything is a cookie cutter approach.
100%. that's the value of the consultation and the role of the plastic surgeon to give the right advice. I will take this opportunity, George, as I know we're coming close to the end of this live, to answer a few questions that have been flying around. We should say that, at least in our practice here in London, most of the facelifts we do are day cases that don't require an overnight stay. We see our patients 7 days after the operation to remove the stitches, and usually people, after the first week, gradually they go back to their activities. Someone asked, I know we were talking about how we perform facelifts in a younger age, but actually there is one question from a patient who is 70, am I too old to have a facelift? Well, actually, you're not, based on your age. It depends on your health condition. So if you're healthy and you don't have any risks from your heart or from your lungs, then you're absolutely fine to have a facelift at age 70. It will just mean that it will be a different type of facelift than the facelift that we would do on a 40-year-old.
I want to show this. One of my patients, an 85-year-old lady that I did her secondary facelift. She had a previous facelift by another surgeon, and at 85, she was still very active and loves life, loves to travel, loves to enjoy the outdoors, and she was very healthy. I didn't see a reason not to do it, and that was about 6-7 years ago. So she's now 92. She still comes for Botox and for skincare. She still looks amazing, but if at 85 I had deprived her of her secondary facelift, I would have done her a big injustice.
Yeah. No, I mean, we live longer lives, healthier lives, so we will see more of these patients. My oldest facelift is 87, so again, it was a patient who obviously was in good health. But I want to say one more important thing, because a lot of people who decide not to do a facelift is because they are afraid they're not going to look natural afterwards, and they feel that a facelift either is going to go wrong and create complications for them, or it's going to be a result that doesn't suit them. So it's important to understand that with the techniques we use these days, and with a combination of techniques that we explained during this live session with Dr. Bitar, you can have a natural result. You can have a result that is you, and it's a result that you don't have to disclose if you don't want to your friends or family. It's something that will look natural, and it will look natural for many years to come. And I think if I can leave one message for our audience today is that we're here not to do what we think is right, but to listen to our patients and to really try to match your expectations by performing the right type of surgery.
Well, I'm glad you said that. First of all, I want to tell you that's one of my favorite results of yours, Yanni. This beautiful lady who was showing signs of her aging, and you did a deep plane facelift on her, and you hit it right on the nail head. Tell us about this patient.
Yeah, exactly. This is a lady who obviously has 3 children. She has never had surgery in her life before, but actually she was not happy about the way she looked, and she really wanted to do something. We talked about non-surgical techniques, and I explained the benefits of a well-performed facelift, and she decided to go for it. It was a brave decision for her, and she really is so happy with the results, because facelift is the operation that can give you the most natural results if it is performed to a high degree of expertise. No other technique can give you these results where you restore basically some of the features of the face of which happen with aging. And this is really the real excellence in facelifting, to understand the aesthetics, understand the aging process and restoring it. And so, yes, I agree. She looks refreshed, she looks younger, she looks more natural, but she doesn't look like she had a facelift.
Well, I want to sort of piggyback on what you just said. I think for the people who are joining us right now, and we thank you all for your attention and your time in our busy schedule, but we felt that this was important to set the record straight about facelifts, facial rejuvenation. We tried to touch upon it, in an educational and fun way. I think if you are now thinking to yourself, okay, where do I go from here? I think it's important for you to find yourself a board certified plastic surgeon or the equivalent, because we have patients from all over the world who are tuning in. We want people to understand that you want to find yourself a plastic surgeon who has the experience of having done facelifts for years. Yanni and I have done facelifts for over 20 years. You want somebody who is able to combine skincare with your facelift, not just to do your facelift and leave you high and dry afterwards. You want somebody who understands the newest technology in lasers, in platelet-rich plasma, in exosomes, in different modalities like Morpheus 8, fractional lasering, different ways of tightening the skin afterwards. In other words, you want to pick somebody who is going to be with you for the journey. You know, it's a marathon, it's not a sprint. And I think that our training, Dr. Alexandridis and myself, has enabled us to be able to take a patient, provide them with a nice plan of action and see them through it. You know, I have patients that I've done facelifts on 20 years ago. Now they come back, they bring me their daughters for a rhinoplasty, their friend for a facelift, their husband for an eyelid lift, or their friend for another facelift. And there's nothing more gratifying than seeing a patient that you have operated on years and years ago who still looks good, is still happy, and tells you that the procedure that you did for me changed my life.
Indeed, it's a very gratifying operation. It's about confidence. It's about really being active in professional circles or social circles, and it's what I call good vanity. It's about really progressing with a high quality of life and enjoying really the benefits of what we're experiencing now, which is living longer and healthier lives and basically synchronizing the way we look with the way we feel inside. So I take this opportunity to thank all the audience and Dr. Bitar. I think based on what we're discussing, and it looks like we could go on for hours, that we need to have another session in the near future, George.
You know, that day I arrived at Albert Einstein in the morning and you came and gave me a tour. Who would have thought that 32 years later we'd be here giving this together, huh?
Absolutely, yes. It's been a long but very fun and you know, adventurous roads to where we have been together, George. It's great to have these conversations.
I think we can say we have been blessed both professionally and personally, and we are very lucky to be able to offer this to our patients. You know, it's a fun day every time I come to work, and I know it is for you too.
Absolutely, 100%.
So kisses to the family in London, and I guess we will wrap it up right now.
Thanks to everybody who really joined us. And if you have more questions and you really are interested in this type of procedures, please contact the Bitar Institute in Washington, D.C. or 111 Harley Street in London. And we'll be happy to answer all your questions.
Take care. Bye-bye.
Bye.